Hello, welcome to How to Avoid Medicare Fraud. I'm your host, Sandra Perry. I'm an AARP working with AARP Ohio to provide informative resources, local advocacy efforts in the greater Cincinnati area, and enriching community engagement opportunities, and it's my pleasure to moderate today's session. I know that many of you are joining us from across the country. It's always fun to see what city you're in. So put in the chat for us what city and state that you're joining us from. Before we begin, I'd like to walk you through how to engage with us in our time together. Move your mouse or cursor across the bottom of the screen and you'll see the Q&A pop up. You'll also see the chat. You're going to put your Q&A questions in that box and use the chat for comments. This will help us to be ensured that we can follow along with your questions instead of scrolling through all the comments to find them. Again, put your Q&A in the Q&A question box and your chats in the chat box. AARP has been working to promote the health and well-being of older Americans for 66 years. We recognize that you are preparing for Medicare enrollment, which is from October the 15th through December the 7th this year. In addition to wanting to make the best healthcare decision for ourselves and your household, I'm sure you want information that will help you prepare for any nefarious Medicare scams and frauds. Therefore, we are recording this presentation. So please feel free to share it with your friends and family, because in the coming days, you will be able to view this on AARP Ohio's YouTube page. We'll put the link in the chat for you. That's AARP youtube.com/@AARP Ohio. I want to make you aware of a free resource. That's the AARP Fraud Watch Network. It is a free resource for everyone. With AARP as your partner, you'll receive information on the latest scams and learn how to proactively spot scams and feel more secure knowing that we advocate at the federal, state, and local levels to protect consumers and enforce the law. If you've been a target of a scam or a fraud, our trained fraud specialists provide support and guidance on what to do next and how to avoid scams in the future. The AARP Fraud Helpline at 877-908-3360 is free and it's available to everyone. We also offer online support sessions for further emotional support. So visit us at aarp.org/Fraud Watch Network. Again, it's aarp.org/Fraud Watch Network. And you will see that in the chat as well as the fraud helpline. Now, it is my pleasure to introduce you to today's speakers. We have Kathy Ray Falls, who is the director of the Ohio Senior Medicare Patrol Program. Kathy has over 25 years of professional experience in local government and nonprofit sectors with an emphasis on building healthy communities. She also hosts a weekly podcast on WMKV, where she speaks to guests about topics of interest to older adults, including Medicare fraud and current scams to watch out for. Kathy is based in Cincinnati, Ohio at Pro Seniors, where she works with a fantastic team dedicated to empowering Ohioans age 60 and older to resolve local and long-term care problems and fight Medicare fraud. Our other distinguished guest is Becky Hayward. Becky is the Outreach Education Supervisor at OSHIIP. OSHIIP is the Ohio Senior Health Insurance Information Program, a division of the Ohio Department of Insurance. OSHIIP provides free, objective, unbiased Medicare information and assistance to people on Medicare in Ohio and their caregivers. Becky joined OSHIIP in 2006 and is part of the OSHIIP Speakers Bureau, which addresses issues pertaining to Medicare, including Medicare Parts A, B, and D, Medicare Advantage, and Medicare Supplemental Insurance. Toward the end of the presentation, you will have the opportunity to ask them questions. So get your questions ready and click the Q&A icon to type your question. Kathy and Rebecca, welcome.
Thank you.
Thank you.
Now, can you guys see my screen okay?
Looks good to me.
Okay, great. Let me put it where I can see it and look at you, or maybe I'll just undistract you from myself. There we go. So I'm Kathy Raffles. I'm with the Ohio Senior Medicare Patrol, and I am excited to be here today with my colleague, Becky Hayward. I think she is kind of my go-to person for all things Medicare details. We all know Medicare is super complicated. That's why our scammers take advantage of it. And so Becky and I work very closely to understand what's happening out there and to make sure that we can share that with everybody else. I do want to share that the Senior Medicare Patrol is a federally funded program, and there's one in every state. So I did notice in the chat when you were saying where you were coming from, there really are people from all over the country. So if you're experiencing anything and you think that it might be some type of Medicare fraud, don't hesitate. You're always welcome to call Ohio and we'll get you where you need to go. But you can also look up your Senior Medicare Patrol for your state because there's one in every state. So just so you know, that resource is there specifically for you. The Senior Medicare Patrol program in Ohio is based out of Pro Seniors. And so I just wanted to really briefly share the services offered by Pro Seniors. We have three main things. We have a legal helpline, and that is a free service for anyone in the state of Ohio age 60 and over. And basically what happens is if you have any questions, it's brief advice. So it's not a free attorney that's going to go to court with you, but there is definitely an attorney on hand to have a 30-minute phone call with you as many times as you might have the need for that. The phone number, if you're interested, is 513-345-4160. And once again, that's open to anybody, state of Ohio, 60 and over. You can call on behalf of someone else. It doesn't have to be the person who is affected that is making that phone call. And then we'll talk more about Senior Medicare Patrol later. Then there's the Long-Term Care Ombudsman. So we are the host agency for 5 counties in Southwest Ohio for the Long-Term Care Ombudsman program. And in that program, we advocate for residents that live in long-term care facilities, making sure that their rights are being honored. So that number, if you're interested in learning more about that, is 513-458-5518. So now, Becky, you're going to have the first portion of this, so I'm going to let you go ahead and take it away.
Great. Thanks, Kathy. We do work very closely together. As Kathy stated, they're with SMP. They have one in every state. We are SHIP with a very careful P there. So OSHIP, the Ohio Senior Health Insurance Information Program. There is a SHIP in every state as well. We are federally funded through the Administration on Community Living, and each state gets grant funds to provide a Medicare SHIP program. Here in Ohio, we are part of the Ohio Department of Insurance. So we sit in Central Ohio, our main office, and provide SHIP counseling. So what is SHIP counseling? It is free. It is objective. It is unbiased Medicare information and counseling services. So when you contact OSHIP, We will assist you on Medicare, navigate you through the program, resolve any issues and problems. What we will not do when you speak to one of our OSHIP staff or one of our many volunteers that we have around the state, we're not going to endorse, recommend, or that's all right,
Sorry.
recommend any insurance products. We don't work with insurance companies. We are not insurance agents. We are not going to tell you which insurance product to take. We are strictly here to help you understand what somebody's options are, and then understand what your option is, what your choices are, and how to navigate that insurance product. So that is what makes SHIPS so unique, because we are this free, truly free, objective, unbiased resource that is here for all Medicare clients. All right, now you can turn it. So how do we do this? I oversee our speakers bureau. So we do have an education and outreach team. So we travel the state, trying to reach every county in the state. We have 88 here in the state of Ohio, if you're not from Ohio, and I have probably been to every single county in the state of Ohio. But we do that through reaching people who are new to Medicare. So they're turning 65. So we do a welcome to Medicare events. Maybe we go out to employers who are trying to reach their soon to be retired employees, different organizations and groups that might have new to Medicare folks. So we do a lot of that outreach and education. We also just do general Medicare 101 for people who may already be on Medicare, and maybe discuss some hot topics that might be going on throughout the calendar year, help folks understand what Medicare is. So we go to libraries and senior centers and other type of community resources. As I said, we also do employer education, a lot of staff training, a lot of HR. So we might work with employers and train their staff so their help can help any of their employees in there as well. And then during open enrollment, we do a lot of events to talk about Medicare open enrollment, what you need to do, the mail you need to pay attention to, what you don't need to pay attention to, what your current options are, and what your choices might be for the coming year. We also talk about any changes and
Uh-oh.
updates to Medicare program. So we do a lot of enrollment events this time of year. We have one item that isn't on here. We do volunteer training too. I think Kathy will address this as well. SMP and SHIP, we train people to help their community member, their neighbor, their friend, their family member to navigate the Medicare program as well. So we are also a volunteer training program. You can go to the next slide for me.
Sure.
Some other additional services that we do. So in addition to all that in-person event that we do, we have a hotline. I like to call this a helpline, okay? So this is a staff of about 20 people. We do fill it a little. It's a little more increased this time of year, getting ready for open enrollment. They are based here in Ohio. These are true Ohioans sitting here in Ohio that answer the calls Monday through Friday, 7:30 to 5, on everything about Medicare. We have different levels of analysts, so some just do general. If we need to escalate an issue, we might escalate it to another analyst who can do some casework on it. But that number is available to you in Ohio. If you are from another state, you have a SHIP in your state that would have a similar number. And I would concur with Kathy. If you called us from a different state, we'll find you the SHIP that you need to contact in the state that you might live in. We also do virtual counseling appointments. What's nice about the virtual counseling appointments, we use Microsoft Teams. We can meet like this. So we can see our cameras, we can share our screens, as well as we can bring somebody else into the meeting. So maybe you are assisting a family member who lives in Ohio, but you live in Texas. We can join virtually and talk about Medicare and counsel their Medicare issues and talk that way. So that is a link on there that takes you to our website at the Ohio Department of Insurance, where you can schedule pick a date and time that works for you. We have a lot of publications that we distribute around the state as well. We have a Medicare 101 booklet that is kind of a condensed version of a Medicare and You. and a variety of other brochures and education material to help folks navigate and understand Medicare. So thank you for having me today. Kathy and I, as we said, we work closely together. We kind of do the what is Medicare, how to navigate Medicare, what to do with Medicare, and the actual program of the insurance. And then Kathy will tell you more about their aspects, but we certainly work together on all of this. So thank you. Enjoy your afternoon.
Thanks, Becky. And I think you're going to stick around for the Q&A section as well. So if people have some kind of Medicare questions, then they can ask those in a little bit. Great. Thank you so much. So Senior Medicare Patrol, I mentioned a little bit about our program earlier. Our main goal is to help Medicare beneficiaries prevent, detect, and report healthcare fraud. So we do that for a couple of reasons. Number one, we want to help preserve the integrity of the Medicare program. That's something that we're all paying into with our taxes. And even people who aren't yet utilizing the service have a stake in that program being able to function for them when they're ready to retire. So the other thing that we do, as Becky mentioned, is we rely on volunteers to help perform some of the work. So that's another common thread with both of our programs and in all states. So I really like to start off here. Maybe people could put into the chat your guess as to how much money Medicare loses every year due to fraud, errors, and abuse. Let's see if anybody's got a guess. All right. And I don't see any answers, so I'm going to go ahead and surprise everyone. It is $60 billion, and that is every year. And that's an approximate amount. Some people say 65 billion. Some say it is all the way up to $100 billion. So that's a ton of money. It's between 6 and 10% of what is spent on Medicare every year. So where does some of this stolen money go? I always like to share these pictures. These actually came from the Justice Department in 2023. So you'll see some really nice cars, 3 boats. This was all one defendant who committed healthcare fraud. These were all the items that he bought with our tax dollars. So I always like to share that because that's your money that paid for that. So Medicare fraud happens when someone is intentionally billing for Medicare services that were not received, or they're billing for a service at a higher rate than is justified. Medicare fraud might also include a provider error, or it might include abuse of the system where it's a legitimate service, but it's not being billed appropriately, or it's being double billed, something like that. So we're going to do a little bit of conversation now to discuss what to keep an eye on. What does this look like? It's really, this is organized crime. So I wanted to share with you the anatomy of a Medicare scam. The first thing that happens is the scammer is going to get your Medicare information. They might get that by calling you and saying, hey, you have a new Medicare card that's coming in the mail. It's plastic, it has a chip, and we just want to make sure that we're sending you the right thing. Can you confirm your Medicare number for us? Medicare will never call you, and they will never ask you for your number because they're the ones that gave it to you. So that is one of the ways that the scammer might get your information. Other possible ways would be through a data breach, and that could be in a healthcare system. It could be through cold calls, or it could be through provider error. Scammers try to scam providers as well. They'll send them faxes that say things like, we now have this patient, we want to give them a brace, we just need your signature, things like that. So there's a lot of ways that Medicare information can get into the wrong hands. Once that number is out in the ether, in the world, in the hands of the bad actors, the scammer may send some products your way. Some of the most recent scams that we've been seeing involve knee braces or back braces. I think that the scammers probably assume that we all have aches and pains in our joints periodically. And so who wouldn't assume that you might be able to utilize a brace? The problem is you're going to get braces that weren't ordered by your doctor for a condition that you may not have. And we really don't know if the products that they're giving you are functioning, because none of this is happening above board. So you might get something in the mail like that, like a package, let's say, or you might get nothing in the mail. One of the other things that we've been seeing a lot of, especially in this past year, are catheter scams. So where a brace could be helpful for anybody, a catheter really is only something that you're going to use if you need a urinary catheter. Then yes, you'll need those supplies, but not everyone is going to need something like that. So scammers know that, and they don't send you the catheters, they just bill your Medicare account. So that is why we strongly encourage people to check their Medicare summary notices or explanations of benefits. If you have original Medicare, then the statements that you get in the mail are called MSNs. If you have an Advantage plan, then you're going to get an explanation of benefits. They're all the same. They're just telling you what has been charged to your account, what activities have been happening. And when the scammer bills Medicare like that, Medicare almost always pays, because they don't want to slow down your health care. And so because Medicare wants to make sure that you're getting the right services, they're likely going to pay anything that gets through to that point. So when you check your MSN or your EOB and you see a fishy charge on there, that's when you're going to call the Senior Medicare Patrol. And what we do is, because we have a Senior Medicare Patrol in every state, we are able to link in to Health and Human Services Office of Inspector General, and we report every single instance that is reported to us, so that the Department of Justice can then aggregate that data, find these people, because they may be scamming you for $1,000, but if they're doing it in all of the states and territories, then that money is adding up, and they can see those patterns. And so your calls, your reports not only help you resolve your own problem and your own Medicare information, they also help us catch the people who are trying to steal this money. Another way that you might be affected by Medicare fraud is that say a scammer bills Medicare for a wheelchair on your behalf that you never receive, and you probably didn't need it at that time. And then a year down the road, you do need a wheelchair, but Medicare has already paid for one according to their records. You might be on the hook to have to pay for that yourself if your benefit period hasn't yet hit the mark where you would be able to get a new item like that. So you might be billed for items that aren't covered. You might be not able to get certain services. Your medical records might be inaccurate. The last thing I'd want to say with this slide is we've recently seen some hospice scams where hospice companies are communicating with people in facilities and offering them their services without involving the people's primary care doctor. And what can happen in a case like that is, if you're receiving a service like chemotherapy or some type of treatment, you may be denied that service because of the care that hospice provides. So I wanted to share a couple of other things with you. This is our ad that we share when we're telling people about the scam with braces. So please keep an eye out. Make sure if you see something that says free braces, it's true. There really is no such thing as a free lunch. If you need a brace, you need to talk to your doctor, let them advise you about where to go and what to purchase. Here's another one. This is one I mentioned earlier. The new Medicare card scams. This is one that apparently people who have been in this field for a long time would call this a classic. So people are contacting people about new cards. They want to get your personal information. They might be saying you're going to get a new card because it's a new year. or they're giving a plastic one. Medicare still has the traditional paper cards. They're red, white, and blue. You have seen them and they're not changing. Every once in a while, there might be a data breach or a reason why a beneficiary would get a new card. But when that happens, almost always you're going to get a letter in the mail explaining that that's happening and coming your way. If you get a new card and it looks legitimate and you're not sure, you can call 1-800-Medicare, or you can call the SMP, Ohio SMP. Our number is 800-293-4767. And then you can check and make sure that that was a legitimate thing. The times when it's not legitimate is when they're fishing for information from you. And that's what we really encourage people to keep an eye on. So to keep it easy, we have 3 main steps that we encourage people to go through to keep themselves protected and then to respond if they do think there is some type of concern with a scam. So number 1, protect yourself and others from Medicare fraud. You should always treat your Medicare card and number like your credit cards. You should watch out for identity theft. If someone is calling and asking you any type of information, first of all, what we tell people, and I know this is hard, I struggle with it myself, but we tell people, if someone's calling and you're not sure who it is, don't even answer. If they have something really important to tell you or find out from you, they will leave you a message. Scammers use a sense of urgency to get us to react. And sometimes we know we've attended a training like this, and we know that really this is not the right thing for us to be doing, but sometimes they wake us up from a nap, or they're really tricky, or we just went to the doctor, or we're not feeling well. So there's all kinds of ways where you might get pulled in and think that they're legitimate. They're very good at what they do. So pay attention to that. Remember, Medicare is not going to call you. They're not going to visit you, and they're not going to sell you anything. So if someone is reaching out and claiming to be from Medicare, unless you've called them and asked for a return call, then it is not Medicare. We are the federal government. Medicare is federal, and it is taking care of all of these people's healthcare needs and ensuring them and taking care of what their bills are, but they are not out in the world calling people from some giant, warehouse or something like that. Definitely do be cautious of offers for free medical services. Once again, braces, but there's also genetic testing. That's a really common scam. So you might get a phone call from someone saying, it's really great to do this genetic test. It's free. Medicare's going to pay for it. We'll send it to you in the mail. They send in the mail. When it arrives on your doorstep, the scammer is notified and they call you and say, we see that your package just arrived. Now go do all of the things and send it back. None of that is legitimate. If it did not come from your primary care doctor, then it is not coming to you appropriately. So if you're not sure, if there's one thing I can leave with you today, check with your doctor before you do anything like this. And then you can report this. So I mentioned earlier that when people report these scams and fraud to the Senior Medicare Patrol, we are able to actually get that into the federal government's hands so that they can help and prosecute these people. So it's really important, especially if you or someone that you care about feels bad or feels dumb that they got scammed. We really try to encourage people to give themselves some grace there, because it's not your fault. If someone is good at scamming people, then they're good at it. And you're going to try to protect yourself, but you can't always do that. So we always say, don't give yourself a hard time. Call the Senior Medicare Patrol. Let us help you. We'll help you resolve your Medicare account issues, but we're also going to just kind of be a human voice. When you call us, you'll talk to Mary Helen. She's here Monday through Friday from 8 a.m. to 4 p.m. to talk to you live. And so she'll really listen to the story of what happened, and she'll help you figure out if there's other places to report. And she will work with you to communicate with Medicare directly to make sure that it's resolved and that you don't have any outstanding charges for items that are not appropriate. And this service is free and confidential. Our program is funded by a grant from the federal government, and so there's no charge for any of these services. So now we have hit our questions part of the presentation. And so I will turn it back over to Sandy and let her kind of moderate that. But both Becky and I are available if you have any questions, if there's more specifics that you'd like, and if you would like to also request presentations. So the Ohio Senior Medicare Patrol, we can provide presentations virtually or in person anywhere in Ohio. If you are in a different state and you'd like a presentation there, we can connect you with your Senior Medicare Patrol so that you can get that taken care of.
Thank you so much, Becky and Kathy. That was wonderful information. Thank you so much. So now we will have our question and answers portion of this event. And again, if you have questions, please put them in the question and answer, the Q&A box at the bottom of your screen device. And let's see what our first question is.
I think it's a thank you.
All right, we'll take it. Thank you, thank you.
I have a question for you, Kathy.
Sure.
What is some of the what are you hearing about scams now? Like what the most calls you're getting on presently?
I would say we call it DME. It's the durable medical equipment scam. So that's when somebody is they're getting a package in the mail. And what we encourage you to do, if you get a package in the mail out of the blue, we encourage you to take a picture of the return address on that box. I think it's okay to open it if you want to open it and see what's inside. Sometimes when you open them, you can see more. Sometimes there's multiple companies that are involved in the scam. And so when you open it, there might be a letter and different brand names and labels. So anything that you see in there, take pictures of. And then you can keep it, you can throw it away, or you can refuse it and send it back. We have had people who've actually spent their own money to send things back because sometimes they come through FedEx or UPS. I don't know. I can't really advise either way on that. But the big thing is gather the information that you can and then call the Senior Medicare Patrol. And then all of those pictures, you share those with us, and that's evidence in a case. So I would say that's probably one of the bigger ones. Very similar for genetic testing. The most recent ones that are DME are ostomy bags. So that is a brand new one that's happening. And that's one where kind of like the urinary catheters, you probably wouldn't get it in the mail, but the billing is going to happen afterwards. The scammers really like things that need to be ordered multiple times so that they can do this. For example, the person who most recently got the ostomy bags, the scammers ordered 40 per month for the first like 3 or 4 months, which apparently is way too much anyway. But then the final month they ordered 120. So they were, it's like when someone steals your credit card, they go to the gas station and spend 99 cents to see if they can get by. So same type of thing. The sooner you are catching what they're doing, the sooner we can stop it from happening.
Well, thank you so much. That was really good information. Is there a way to stop phone calls from senior benefits is one question.
Yeah. Well, so there are, through the Federal Trade Commission, there's a way to stop like robocalls. But the problem is the law only applies to the people who follow the law. So scammers are not worried about breaking the law. They're already breaking the law. So unfortunately, the best thing to do is just not answer. If you are using a landline, then the phone company does have some options that can slow down those scams, where you can, you've probably experienced it. You call somebody and it says, please press 1 to prove that you're a human or something like that. So if you use a landline, there are some options through your phone company, and you can call them and find out what they might be able to do to help keep you from getting too many. But unfortunately, the law is not enough to stop those calls.
Mhm. Very helpful and good reminder about not everybody follows the law.
I would
So,
grab your grandkid and tell them, show me how to block these calls every time they
Yeah.
come in. Block the number, block the number, block the, and I do that with my own parents. I block the number and then I block their email constantly and mark things. I mean, like we do a total clean out of everything, but I have to do it every time I come.
Yeah.
Question in the Q&A, can we call Medicare directly about scams? And is there greater benefit in calling you?
So I would say yes, 100%. You can call 1-800-Medicare to report a scam. And if you do that, then they are going to give you an option based on what experience you've had. They have kind of a script that they go through with very specific questions to learn about the scam and what you experienced. So sometimes they will automatically offer to give you a new Medicare card, a new Medicare number, because your number's been compromised. If you haven't yet seen any charges on your summary notices, they might say, thank you for letting us know. We'll keep an eye on it. If you see a charge, call us back. So that is a fine thing to do, and it will help you, because either way, it's going to make sure that Medicare knows that from that date forward, if charges happen, you've reported it. And so you have some kind of support behind yourself of, that wasn't me, that had nothing to do with what I was doing. I would say the biggest benefit of calling the Senior Medicare Patrol is that you're helping your friends and neighbors, because we're gathering the information and we're educating. So a lot of what we do, in addition to reporting to the federal government, is we're educating. We have lots of materials. We're out talking to people, doing things like this, and kind of aggregating that information. And we're just kind of we don't have any time limits. We don't have any scripts. So if you just want somebody in town, we also have over 30 volunteers and 6 staff that are traveling throughout the state. So say somebody just isn't comfortable making those phone calls on their own to a call center or whatever the case may be. It's just kind of an extra like handhold process. But yes, you can call either SMP or 1-800-Medicare.
Right. Great clarification.
It's a good question.
It is a great summary. Next question we have is, my Medicare Part D insurer contracts management to a third-party company. I was overcharged $49 instead of $10 for a prescription. I finally got the insurance company to admit the overcharge, but the contracted manager will not approve a refund, and the insurance company will not take responsibility for the error by their contractor. How do I resolve it?
That's probably mine, Kathy. That seems like a call to OSHIP. I guess I'm not understanding the third party there. That I would need to know what that means on that. Medicare Part D plans have confirmed costs for prescriptions, depending how they are listed in their list of covered drugs. You know the tier, you know the copay, you know what the payment would be. So if there is a discrepancy of like that, and it is a result of being charged incorrectly and by whomever, that is something we can look at. But it does sound like it needs to go to our hotline, our OSHIP hotline, to make sure that is actually the story of why there was a change of $49 rather than $10, because the drugs are set copays based. Each of the plans, of the Part D plans, depending on what you have, is going to have a set cost ahead of time. So if somebody didn't honor that set cost from the insurance company, or how, that's why to me the third party doesn't make sense. but maybe it wasn't billed properly by whomever took the prescription, or it wasn't charged properly, or maybe the prescription wasn't on the formulary, or it was the wrong level. Something else is involved with that story. So yeah, that would certainly be something on the OSHIP hotline that we can look at to see where those gaps are. Because to me, the explanation doesn't sound right. But you may not be owed the money. There may be something might have happened. So the insurance might have said, yes, that might be right.
Good discussion. Next question. Do you ever run a program to attract fraudsters?
No, that's an interesting idea. It's probably out of our realm of what our grant would let us do. Plus, I don't know, I think I'd be a little wary of that.
Right. I'd be nervous.
I will say there are some people out there who have been convicted of scams, not necessarily with Medicare fraud, but they've been convicted of certain types of scams, and then they go to prison, and when they get out, they spend their lives educating people on how to stay safe. So so there are some things like that, and I try to attend those trainings, but I don't think that I don't really want to do that.
Okay. Another question. What are the penalties for Medicare fraud?
Good question. I mean, people go to prison. The thing is, it's organized crime. And when it is, there are parts of it that are happening in the United States, but there are also a lot of parts of it that are happening overseas. And I do think that makes it really hard to prosecute fully and kind of get resolution. So mostly people need to pay the federal government back, and they need to go to prison, and they need to, you know, give all the boats and cars and everything else away.
Watches. Right.
Right. Thank you for that. Another question. Can Medicare fraud occur with the telehealth services?
Yes, it can. And as a matter of fact, someone might, if you get some of the scams I talked about, like the genetic testing one, if someone calls you and says, you know, I think you got your genetic test in the mail, this, that, and the other, sometimes they'll bill that phone call as a telehealth visit. So there are phone calls that you might receive from someone that will get billed inappropriately as telehealth. There's also, I forget what they're called. They're like trackers that sometimes people might try to send, and then they would bill that as some type of like remote monitoring type of thing, which is kind of a version of telehealth. And that also, if it's not coming from a doctor of yours, then that it also is fraud.
Okay.
So, but also there's always potential for like inaccurate billing and some other types of fraud that have to do with telehealth. So definitely if you sense something fishy, you should trust your gut and call somebody, and we can help you figure it out.
Okay. Yeah, that's good to know. Good summary. What does Medicare, how does Medicare fraud impact the beneficiary directly?
That's a very good question. So one of the things that I mentioned was that you might not be able to get a service if Medicare thinks they already provided it, like a wheelchair, something that's like a limited service. It can affect your medical record. So if somebody's sending you diabetic testing supplies and you don't have diabetes, and that shows up on your medical record, that can be a problem. Because one of the things that's happening here is, in some cases, you have people who are actually medical providers in the United States who maybe get kickbacks for signing off on an order. And so they're going to order something for you. It's going to look to the pharmacy and all the other records like it's legitimate because it's signed off on by a doctor. So it can affect your medical record, which, you know, that's your information that doctors use to help determine how to treat you. And then, you know, the worst case scenario is kind of what I alluded to earlier, where if you get placed in hospice care, for example, then for the diagnosis of cancer, and you don't want hospice care, then you won't get your cancer treatment.
Right.
So that's probably the worst one.
Yeah, we were talking about that this week. That's awful.
Yeah, yeah.
Really could cause a
And
lot of
yeah,
complications.
and it could be smaller. It could just be that Medicare only pays a certain amount for something. So then Medicare pays for something and then you owe the rest.
Mhm.
And you would be paying for something that either you didn't receive or that wasn't a legitimate thing for your health.
Okay.
Or what if you're using a brace that's not a good brace
Right.
and it causes more pain? Like there's a lot of kind of weird things. Genetic testing, if you return a genetic test to a fraudulent company, you might get a report back that says you have all kinds of diseases that you don't. So it's a lot about accuracy. Becky, it looked like you had something else you wanted to share.
Well, I was thinking also with the that no wait, now I lost it. I lost it. Sorry.
That's
I,
okay.
Well, some more questions in the chat have come up. In the Q&A box where we're putting our questions for clarification. If your card is compromised, does Medicare issue a new card?
Yes, they do. The inclination when you call Medicare, the inclination for Medicare is if they haven't seen if say somebody called you and got your Medicare number, you accidentally gave them your Medicare number. If you call Medicare directly, they're going to say, keep an eye on your Medicare summary notice. If you see a charge, call us back and we'll give you a new card and a new number. But if you would feel better asking for a new card and a new number, you can ask for it in advance of those charges. So that's really up to the beneficiary.
Mhm. It's really good to know.
Mhm.
Thank
I
you.
remember what I was going to say. Remember this? There was this. So the scam about the CMS Medicare pays for COVID tests, and
Mhm.
people were getting them in the mail. I was at in a hospital setting where someone told me my mom keeps getting all these COVID tests in the mail. She's not paying for them, but I think she's up to over 100. Now, mom didn't think anything of it because one, she's not paying for them, but we had a volunteer get them too. Well, not get them, but she saw it on her Medicare summary notice, and she's like, Medicare's paying $900 on this. She said, I'm not paying anything on this, but those are my tax dollars doing this, giving them money. And she didn't even get the COVID test, but she got it on her Medicare summary notice. So even though wasn't any out of pocket cost for her, she still called to report it because she knew that the other woman, I think, was like, well, she's not paying for it, which is unfortunate because somebody is paying for it, right? And we are all kind of in this together.
And, the other thing, what we heard a lot of with the COVID test is that they were sending expired tests. So that goes right back to you
Right.
personally. If you don't realize
Right.
that you have an expired test and you use it, it might give you the wrong information.
Right.
That can affect your physical well-being. So.
Right. Okay. Next question. Does OSHIIP help find the correct supplemental plan to go with parts A and B?
So we will review all Medicare supplemental plans with folks. We have a tool, website tool, where we can look at all the plans. We're not going to just give you one company. But we will help you navigate. So if there's a particular lettered plan you're looking for, say you want to shop for all Plan Gs, we'll give you all the information about the Plan Gs that are sold.
I lost my.
There. Hmm.
That was weird.
There.
Can you still hear me?
Mhm.
Yeah, my audio changed. Okay, so that's how we will do it. We're not going to, and then our Medicare handbook that we have lists all of the companies, and you can contact the company directly at that point.
And I'll say, just on behalf of OSHIIP, I would like to say that what I tell people a lot is there's a lot of trustworthy brokers out there, but there are also some that are making money off of recommending certain plans that might not be the best plan for you. And so OSHIIP is a nice alternative to that. It's a place that you can trust. They're not going to make any money off of any decision that you make. So
And if there's an agent that you work with, you can take that information, say, hey, I already did some research with OSHIIP at the Ohio Department of Insurance. Is this something we can talk about? So I often tell people, and I have the book, if you have a meeting with an agent or a broker, although it doesn't work because it's white and I'm on a
Nope.
white screen. There we go. You can always take this with and say, hey, and so that they see it and so that you can so they know you're coming educated, right?
Yep.
Good, good, good. Next question. Shortly after an urgent care visit, we started getting scam calls, and one of the callers had the real medical info from the medical record. How could that happen?
I don't have a easy answer for that one. I mean, there are data breaches that happen in hospital systems, but I would say usually the hospital system, what I have seen so far is when they realize that there's been a data breach, they're very good at kind of proactively reaching out to their patients. So I don't have a direct answer for that, but we do report stuff like that all the time. So if something like that happens, we can talk further with you and then help you figure out who to call to make sure they know that something's fishy's going on.
Okay, so even with this caller, they specifically referenced they were at a urgent care rather than a hospital system. And some of those operate independently, so then you would be able to help assist further with their.
I would say
the
senior, I wouldn't hesitate to call Senior Medicare Patrol. It would probably be a referral. And if they were in Ohio, I'd probably send them to the Department of Health. And there's some online reporting abilities for different medical facilities. So we'd help them figure out how best to report that.
All right. Well, thank you so much. Well, I'll ask one last question. Oh, wait a minute. We may have one more additional one. Oh, there's a follow-up. We did report it and we were told that they could not determine who leaked the information.
Well, if it's an Ohio thing, either way, I'll repeat the Senior Medicare Patrol number. And if you want to talk further, I'm happy to help you figure out who would be the right person to talk to. It's 800-293-4767. That will get you to Mary Helen, and you can tell her that you were on an AARP webinar and that you're calling in response to that. And we'll work with you, figure out what could best help you there.
Right. Thank you so much. One last question. Are there fraud schemes that target specific medical conditions?
Let me put this in the chat because I'm horrible at multitasking. There we go. Okay, so that's our number in the chat for you. Specific medical conditions. I can't think of anything off the top of my head because for the most part, hopefully the scammers don't know much about our medical situations. So
I would think that maybe it's a shot in the dark, 1 in 2 people have certain types. So, they're likely to, hit somebody up if there is a scheme. I'm not aware of one, but maybe that's one I need to look into. No, I could see them doing that, saying, much like the durable medical equipment, they're going to assume somebody has COPD and we're going to send you something or whatever it might be. Right. And they're just going to guess, a shot in the dark, knowing that, so many people have that.
All right. Thank you so much. And Kathy, you did put your number in there. There was a question about how do we reach Kathy to request a health tracker? Okay.
Yeah, that number's great. And if it's the Medicare booklet, though, the Medicare 101, then you can let me know. I have some of those. Becky gives us all her goodies too. So you're welcome to call me. You're welcome to call OSHIIP, and either of us, we all have each other's materials. So we'll get anything out to you that you would be interested in utilizing.
Well, thank you so much, Kathy and Becky. It was a pleasure having you today. And I will give you, okay, let me back up just a little bit. We're drawing near our time together to the end. And we are recording this presentation so that people will be able to view it in the upcoming days. And we put the link in the chat for you, and just a quick, it's youtube.com/@AARP Ohio. It was so pleasurable to be able to have you both here today to give us this information, and I'll give you a moment to share any closing remarks with our audience. Anything else you'd like to share at this point?
The only other thing I'd like to share is for anybody who is attending from Ohio, we love coming out to do presentations. We even will host games. If you have a group either at your church or at maybe an assisted living or senior living, or even just like a recreation center, we'll come out and we'll do fraud bingo games with prizes and the whole 9 yards. So we really like getting to know people in the community. So please do reach out if you think that might be something of interest to you, family, friends, whoever.
Thank you so much. Before we close, I'd like to highlight a couple of ways for us to engage with AARP. I've been a volunteer with AARP for the past 2 years, and I have loved this experience. It's given me an opportunity to share my skills, my talents, my passion to be a part of a movement that AARP helps to enrich the quality of life for 50 plus and older. And so being able to participate in activities such as this, being a part of bringing resources and a wealth of information within my community across the state, that is why I'm a volunteer. So did you know that there is a new way for you to experience AARP by volunteering with us? So often I hear people talk about the red card. I have it, I'm a member. But it's about the opportunity where you can volunteer, where you will be supporting family caregivers, helping to make your home and your community more livable for everyone. As we age, we will help prevent fraud, engage voters, and support legislation and policies that benefit the 50 plus community. You can have fun enjoying sporting events, cultural activities, and being engaged in your community, or even being a volunteer from your home. Many AARP volunteers around the country find volunteering to be very fulfilling experience. So if you're interested in becoming a volunteer, visit aarp.org/I want to, that's the number 2, volunteer. Again, we'll put that in the chat, and that is aarp.org/I want to volunteer. We hope to see you at the next AARP virtual events coming up. They are the 3 B's of music. That's Beatles, Beethoven, Bach, coming to you October 15th, the 8th, the 15th, and the 22nd from 7 to 8:30 p.m. Eastern Standard Time. Again, the dates are October 8th, the 15th, and the 22nd. Join us as Barry Weinzenfeld, international award-winning musician and music faculty of SUNY and Ramapo College, will explore the phenomenon that was the Beatles, the unrivaled music of Beethoven, and the monumental works of Bach. Also, AARP will provide resources on brain health. You can register for these events by clicking on the links in the chat and AARP's Virtual Community Center. That's at aarp.org/VCC. VCC, our Virtual Community Center. We'll have this information in the chat or on AARP's Ohio page, aarp.org/Ohio. Any of these links will allow you to register for the events. And finally, those are the 3 B's of music, the Beatles, Beethoven, and Bach, on our community center link. And finally, AARP is local, offering meaningful connections and enriching experiences close to home. To find AARP events near you, visit aarp.org/local. aarp.org/local. It's been my pleasure to be with you today, and in a few minutes, you will receive a survey. Please take time to complete this survey because it helps us to continually improve our offerings. Thank you for joining us, and we hope to see you at another event. Goodbye.